Hey, so smoking is pretty cool, right? And the only warning signs on the box are that the cigarette smoke contains carbon monoxide and the product may cause mouth cancer. So it looks cool, and it won't even affect me that much, right?
Wrong. Smoking is a very bad habit. In fact, 80% of all smokers wish they never picked up that first cigarette. Americans who smoke add another $500 billion in health care, but not even that much money can save them from an early death.
But all my friends are smoking, and these cigarettes have filters in them. Plus, I spent about $6 on these. What could be the harm in just having one pack?
Just because these cigarettes have filters doesn't mean they are better for you. It's like saying breathing poison is less bad if you breathe it through a screen. Also, if you get hooked on nicotine, instead of wasting $6 on that one pack of cigarettes, you just threw away $4,000 per year, not even including medical bills. So if you even smoke one pack, you could get hooked.
So why would anyone care if I smoke? It's not like it hurts anybody else.
Not only does smoking affect you, but it affects others around you. People die from secondhand smoke or can get diseases. You're also putting children at risk.
What are the effects of secondhand smoking?
The effects of secondhand smoke are much less severe, probably, than primary smoking. It can affect people who have lung diseases such as asthma, but there's not the increased risk of the other issues such as cardiovascular problems or cancer in those who are around people who smoke.
I've been smoking for so long. Is it still worth quitting?
No matter how old you are or how long you've smoked, quitting can help you live a longer and healthier life. People who stop smoking before age 50 cut the risk of dying in the next 15 years in half compared to those who keep smoking. Ex-smokers enjoy a higher quality of life with fewer illnesses from cold and flu viruses, better self-reported health, and reduced rates of bronchitis and pneumonia.
What's the longest somebody's smoked and then been able to quit?
I have a number of patients who have smoked for 40 or even 50 years, and then when they have decided it's time to quit, they're able to do so.
What are some of the major risks with smoking?
Cardiovascular disease is a major risk. Smoking can contribute to high blood pressure, to heart disease, meaning obstruction of the coronary arteries and heart attacks. It can then lead to heart failure as a result of heart attacks. It can also increase the risk of strokes and brain damage. And there's increased risk for many different types of cancer, particularly lung cancer and head and neck cancer.
Okay, you convinced me, but will it be hard for me to quit?
For a smoker, the most important thing is that they are the one that wants to quit, because it takes a lot of effort and strength to be able to do it, although it is very possible. Once they make the decision, they will go through a withdrawal process to withdraw completely.
What does it take to quit smoking?
I think the major component is the patient themselves wanting to quit smoking. They actually have to genuinely, for their own reasons, want to quit, not because somebody else wants them to or because they feel pressure to. And then once they've made that decision, there are a number of different medications that can be used to help them. But those do not make somebody who does not want to quit. They, again, have to want to quit themselves.
Why is it so hard to quit smoking?
Nicotine is the main reason it is hard for people to withdraw. It is an addictive chemical that acts as a depressant and gives the user a pleasant feeling. Quitting can cause withdrawal symptoms from nicotine because it works physically and mentally.
Why is it so hard for people to quit smoking once they've started?
Smoking is very addictive. There are some studies that show that it's as addictive as cocaine, if not more so. And so for that reason, it's very difficult to quit.
So, Doc, has it benefited me to stop smoking?
Well, as you can see, these are lungs from when you were a heavy smoker, and these are your healthy lungs now.